Now that we've learned the theory of clear aligner therapy, I'd like to now talk about the second space concept. Remember, we said space underneath the aligner is called open architecture. Space between the teeth, well, that's called IPR and ARS. Our goal is to do both. So we just need to understand what it's about. So there are 5 ways to make space between teeth. Only 5. You can push a tooth 3 ways, right? You can go transversely, forwards or backwards. That's 3 ways right there. Remember I said there's 5 ways to make space. The first 3 are easy. The next one's easy. You can pull the tooth out, right? We don't want to do that though because people want to keep their teeth. The last way is the most obscure way, which is change the shape. And what's weird about when you change the shape of teeth is if you take 1/10 of a millimeter off of a tooth, it doesn't mean that you can close 1/10 of a millimeter of space. Because when you change the contours of teeth, you can legitimately get the teeth to close closer together. And when you're talking about like an incisor that's very flare-shaped, right, and you make it more parallel-shaped, not only are you bringing the teeth closer together, but you can kind of close up what we refer to as black triangles. So IPR and ARS has a couple different purposes in our world right now, one of which will be to make our teeth successfully move, but another will be to cosmetically reduce some of these ugly spaces we see in people that have very crowded teeth and a lot of bone loss. And I'll demonstrate this for you. So ear rotor stripping was first talked about by Sheridan back in the late 70s, and it was in his book. He said you can do 8 or 10 millimeters of arch length creation by taking a safe-ended burr and going between the teeth and cutting these slots. Now, it is possible that sometimes you can do stuff like this, but the problem is that, you know, from my standpoint, I see a lot of adult care, and you know, probably over 60% of my practice is adults. From a perio standpoint, not so safe. You'll get the teeth too close together potentially. You'll infringe the biological width. You'll create situations where you have constant inflammation, and it won't be a picture of health, to say the least. So I'm not a big fan of this. I'm going to describe 2 different concepts for you. The first is interproximal reduction, or what we refer to as IPR. Now this term, as of recently, really came to light because of the Invisalign company, because they relied very heavily on IPR in order to make space for the ClinCheck files to be able to physically get the teeth to derotate and to line up. And interproximal reduction, in my mind, means I'm going to do it by hand, okay? If I want to use a handpiece, then you're going to use an air-powered drill or an electric-powered drill, but typically it's air-powered. So you'll hear another term called ARS, which is air rotor stripping. Air rotor stripping will suggest that you're going to create the space between the teeth using either a slow or a high-speed drill. Why do we want to use IPR and ARS? Well, it's quite simple. Teeth already wear. We know this. You know, every tooth has a ligament around it unless it's ankylosed. When we do it by hand, we're really not doing anything unorthodox. We're going in and we're trimming teeth, assuming you don't go through the enamel layer. We're doing what naturally occurs. We're probably doing it on a surface that may not normally wear. And that's okay, because as long as you don't breach the enamel, that surface will remineralize. So our goal is to actually leave a patient healthier than how we met them. So if they've got big, deep pockets, and they've had some calculus removed, and now they got some ugly spaces, and now we're closing all our teeth together, our goal is to create stability. So we do not want to cause any caries, or we don't want to set them up to have any issues like that. But we will talk about how enamel mineralizes and how to get it to mineralize a little quicker if we need to. And every now and then you'll have a case where maybe you'll combine some bonding with it. Now for the restorative specialists in the room, MTM is a great predecessor to a really, really, really beautiful restorative case. So if you're doing a veneer case, MTM may be a predecessor to a veneer case. And the reality is, you can include the price of your MTM in your veneer case. Nobody said you had to charge separately for it. So we like to say we contour, we slenderize the teeth. And I would like to think that from my standpoint, it makes a little bit of sense to think in terms of, what can we do in order to make a patient happy? So the typical case in my office will have 3 millimeters or less of IPR or ARS. Oftentimes, maybe 2 millimeters for a lower incisor. And that's really for someone who was very crowded at the onset and has very flare-shaped teeth. Sometimes it's 1/10 of a millimeter just to get the teeth so they don't stick on each other as you're kind of going back and forth. As Sheridan pointed out, he thinks ARS maximum is around 8 to 10 millimeters in an arch. I'm not a big fan of that. I don't suggest that. When you do ear rotor stripping, you have the ability to apply a topical gel format of fluoride to help the teeth remineralize quicker if you're worried that you're a little deep. The reality is, if you contour shaped teeth, the surface will typically remineralize in how many minutes? Do you guys remember your histology at all? Probably not. Guess in terms of minutes or hours or days, how long does it take for a tooth to remineralize? 2 hours. So that's the reality. You're not going to do anything too terrible. The most that we like to take off on a single side of a tooth is 1/2 millimeter. That's a really aggressive amount of enamel to remove. In a year, if I do that twice, that's a lot. I probably don't even do it twice. So we'll talk about a couple different ways of figuring out how to IPR and ARS. So as burrs go, the burr that I like if I'm using a high speed is the 5500. There's whole ARS kits, or you can buy just a single burr. I highly suggest that you have a couple of different style burrs. The 5500 is good because it's great for breaking contacts. And the part that's interesting about this burr, do you see how it's got almost like a chamfer here at the base? So literally, you start in the black triangle and you work your way up to the incisal edge. And the bigger space you want to IPR, the deeper you push the burr into the interproximal, because the burr is thinnest at the tip and it's thickest at the base. All right, so it would look something like this. These videos are compliments of David Gallagher.
This represents the embrasure of the tooth. Once removed, it cannot be replaced, and the tooth morphology and appearance will forever be damaged. It is also difficult to make very small spaces.
And you'll notice,
since the minimum thickness of
when you put your high speed in,
between the teeth often
I would suggest that you don't do more than 4/10 of a millimeter, which is the thickness of a burr. Okay? David Gallagher is president of it's called AACO, American Academy of Clear Orthodontics. It's a clear aligner society. You can look it up on the web, aaco.org. I'm an advisor to the AACO. I think it's a nice organization. The journal really is good quality. They got great articles. They've got a lot of contributors. There's about 20 people on the board or advisors, and they've really done a very nice job of creating something that people can look at. This is the 699 burr. It's more for premolars, if you're going between the premolars. I'm sure if you're in an office that's well stocked, you already have some burrs that you like. I'm just showing you what I think works pretty well. And again, this is not like my ideas. These have been proven for a long, long time now. Just remember that when you go in and you strip, that you need to make sure that your surfaces are polished and not sharp, or that they don't have any sharp edges. The gauges that I just showed you before would be your way of notating in your chart how much IPR or ARS you've done. So you can take the gauge, you can drop it between the teeth, you can very clearly tell how much you've done, and then you literally notate in your chart IPR, interproximal, 23, 24, 0.2 millimeters. So I'm going to show you using space files how you can know exactly what you got, because the space files all have a thickness to them. So if you're using a system where the file is, let's say, 0.3 or 0.2 or 0.1, if you can get the file in, then that's what you write down. And if you got to force it down a little bit, then just go back and forth a couple times till it comes in and out easier, and that's it. Okay, so this is a diamond disc. This is the guard that I use. So that's me starting the contact. This is me pushing through the contact, and that's me all the way through. And I'm rotating the plastic guard into the facial surface of the incisors to really hold it down as the diamond goes, because sometimes that thing wants to kick on you as it starts to grab the enamels and it's cutting. Now what's interesting about a diamond disc is you can buy these thin or thick, flexible, non-flexible, grit on the top, grit on the bottom, or grit on both sides. So we have 9 sizes of discs in our office for every scenario you can imagine. So this is diamond disc for doing air rotor stripping. And again, here's what here's what it looks like.
The second common method of performing IPR is
because it's an animation, there's no guard on it. But you would never do this without a guard. And the thing I want you to be careful of, did you see this is showing ledging? You can see the ledging right here. And that's what you must be careful of if you use air rotor stripping, that you do not ledge something. So that's why it's important, probably, if you want to use a diamond disc, that you use the ultra flexible disc. And you really must try to line it up appropriately as you start to drop it through the contact. Okay, so again, here's my double-sided ultra flexible disc, going through a tight little contact. And you can see this is a very real shot in my office where I've got one hand retracting the lip, I got the other hand holding the nose cone of the handpiece, and I'm really forcing this plastic guard right into the face here, so in case it grabs and skips, it throws the guard into the tooth surface and it can't really go anywhere. In the original book from Sheridan, he suggests putting in some rubber separators for a few minutes before you use a disc to create some space, and it's not a bad idea. The disc is spinning so that the disc is turning towards the gingival margin. Yeah, so it's throwing the disc into the tooth, if you will. Yeah, if you go towards the lip, you could very easily catch a lip, so I don't want to do that. So this is the thing I use the most. It's called the Flex Fuse strip. I autoclave them after I use them. I probably can get 6 to 10 patients worth of use before I throw them away. There are many times when I do not want a new strip because I just want a little bit of contouring, and I want the contouring to go slowly. If I've got a lot to do, I'll pull out a brand new strip. So we have a tackle box, and we have the sterilized ones, and we have brand new ones, both in the same box. And I just make my decision, and I'll tell my staff up front, I call it a polka dot, so my staff knows what that means. So I'll just say new polka dot, old polka dot, and that's it. And it's just at the chair waiting for me. And then I'll just notate it in my chart, or if it's the service center, I'll check off on my physical sheet that I've done it, and I'll put my initials. That way I know what I've done. And that's what the strip looks like. There's nothing too fancy about it, just goes back and forth.
Is using finishing strips to slowly abrade the enamel off of the proximal surface of the tooth.
What's good about this that nothing else can represent, this strip is awesome when you have teeth that are overlapping. It's probably the only product you can use. And again, any real product has these polka dots, like I said, and what it's doing is the polka dots are carrying away the dust from the enamel. And if you don't see those polka dots, it's going to be too stiff, and you won't be able to really contour the way you can with this. Now you'll notice too that this side's the bald side. So you can, you'll be able to see the diamond. It's a little bit lifted on the side where the grit is. So you can really put the safe side up against the canine, and I know I'm not going to get any contouring there. The last product we'll talk about are like hand blades. There's diamond coated and there's diamond embedded. Quick strips are diamond coated. When you use them, the diamond comes off. Space file is actually diamond embedded. And when you use them, the diamond grit remains on these files. So I would suggest that you buy a set of space files. Okay, so I'm just going to show you really quickly how this works. Rubber grip here, green file there, right? Everyone sees that? To make this work, do you see the hole there? If you look closely here, does everyone see the shadow? Can you see the perforations? But when you look at it, you can't really see them. If you hold it up to the light, you'll see the perfs. But if you look down at the file, you won't really see the perforations. Like I told you, the better quality stuff is all perforated. Take the handle, stick it through the hole, and then you're going to have to snap this thing all the way down. When you go like this, don't put your thumb on the edge, you'll cut your thumb. Rather, hold it down on a counter and then push, and you'll feel it snap into place. And when it's done right, you'll see that the file actually sits below the edge of the rubber a little bit. Okay? Now, as opposed to doing it like this is how you hold it when you do your IPR. And this becomes very doable. Why do I like the space file system? If you don't do it like this, you can put this on the end of a handpiece, which I'm about to show you. So the space file system just has a whole lot more options, and I think it's actually just well made. You can put it in the blue rubber grip here, which is also autoclavable. You can put it on the end of a handpiece, the ideal handpiece system, or Cavo, if you have a Cavo system. Or you can hold them on individually. So there's multiple ways you can use these files, and these files are going to last multiple times when you autoclave them. How do you get started? You start with that really small file, that 03 file, the gray one. So what I like to do, I have multiple little blue rubber grips, and I just have my staff put them at the chair, literally already in the grip. Or it takes, that's for me to spend the least amount of time. This is the diagram that's actually in every box. It will literally tell you the thickness of every single space file. One-sided, two-sided, bicolor, and it's in every box. So this is a nice little sheet. Just keep it somewhere in the office, or in my case, like I said, we just have a tackle box, and we wrote the size, the thickness of the file on the box itself. So I just know what to choose. So I'll tell my assistant, get me the 0.2 millimeter space file. I'll say 0.1 and 0.2. And they'll put out 2 files or 3 files. And that's it. It's just not that hard. Or I'll ask for a polka dot. And they know that's a flex view strip. This is what the handpiece looks like. And the handpiece, I didn't know what to make of this thing at first. It literally vibrates. It doesn't saw back and forth. It vibrates. So what you do is you just get the blade between your teeth, between the patient's teeth, and I guess it does go back and forth, but it's more like a vibration sensation. The one thing I'll say is the patients say it tickles. So if you want to use a handpiece, it looks like that. If you're using the finger blade, it looks like that.